Using the wrong names for objects, putting, say, a watch in a freezer or an iron in a stove or under the bed, having trouble learning new things, problems speaking, understanding speech, expressing one's thoughts, even problems reading or writing. Wandering, this can be a big one. Getting lost in a familiar neighborhood, wandering around, trouble handling money or paying bills, even repeating questions. All of these can be signs of dementia. Dementia is really the loss of cognitive functioning. That means it's a loss of the ability to think, remember, to reason, etc., to an extent that it literally affects a person's daily life and activities. Dementia is caused by the damage to brain cells. And by the way, dementia is sort of a category. In other words, there are types of dementia. The most common type of dementia is Alzheimer's dementia, but there are many different types of dementia. And a lot of people ask, is it normal to forget things? Yes, it's actually normal to become a bit more forgetful as we age, but dementia is actually not a normal part of aging. It's a serious disorder that actually interferes with daily life. Other symptoms, taking longer to complete normal daily tasks, maybe losing interest in normal activities or events. Sometimes people hallucinate or have delusions or paranoia. They may act impulsively, have personality changes, all of a sudden seem different. Those are things that can also go with dementia. So dementia is not just about memory, it's also about language, visual perception, problem solving, everyday tasks, things like that. There are risk factors for dementia that we know about. Age is probably one of the strongest risk factors for dementia. Also, another risk factor that we cannot control is our genetics, right? Family history, things like that. But other risk factors can include things like smoking, uncontrolled diabetes, even high blood pressure, drinking too much alcohol. I've done a number of videos on, the importance of having controlled blood pressure, diabetes, etc. This is another reason why that's important. Keeping those things healthy is not just good for your heart and other parts of your body. It's also good for your brain and your mind as well. People can have varying symptoms of dementia. As we know, some people have mild forms of dementia. Other people have more severe forms or rather symptoms. And as I said, there are different types of dementia. Alzheimer's, again, is the most common. I would say, to be honest with you, I think as a family doctor, treatment is tough. We do have medications that may slow down the progression of dementia, but honestly, I wish we had more, to be honest with you. There are a number of resources available to people who have dementia, things like, physical therapy, occupational therapy. There's, home health aides, daycare, adult daycare centers, all of these things, which I really encourage people to seek out if you have a family member with dementia. Also, as you check with your physician or the physician of the loved one, there are things we can help out with, sort of assistive aids, whether it's, wheelchairs or canes, walkers, things like that. I mentioned home health aides. Social workers can also be so important in this reign. They're important all the time, but especially in this endeavor as well, to, again, get more resources. Check out your county or city's Department of Aging. They can also be very helpful for things like, meals delivered and stuff like that. That can be really awesome. Again, respite services. But I would also say the caregiver is important as well, just as important, in my opinion, as a patient. It can be very, very tough being a caregiver. It really can be. So caregiver resources is so important in making sure that you're taking time out for yourself. My advice, and this was just a very, very sort of 10,000-foot overview of dementia, is, if you or a loved one is starting to exhibit symptoms that you don't understand or don't seem normal or don't seem right, no matter what they are, you need to talk to your doctor about what might be going on. There are tests that we can do, not only physical exam, but also sort of cognitive testing that we can do in the office. We may send the patient or your loved one, etc., for imaging. There's a number of things we can do to evaluate what's going on. I would also say this: remember that what may seem like dementia may actually not be dementia, it may be something else. So these are symptoms to always get checked out, regardless of whether you think you know what's going on or not. Sometimes there are forms of dementia that are reversible, underlying conditions, whether it's a B12 deficiency or, other conditions, right? So this is why you want to get checked out or have your loved one be checked out. Again, a 50,000-foot overview. I want to just touch base about dementia. Any signs or symptoms that are concerning to you, please make sure you see your doctor. Remember, and let me know, by the way, what are your thoughts? What are your experiences? Please write in the comments. Oftentimes what you write helps other people. And please share this video with other people who may be able to benefit from it. I'll do more videos on dementia as well. I'm Dr. Jen Caudle, guys, on Facebook. Please like and follow my page. For those of you who send stars, I respond personally. Thank you so much. And consider joining my subscription group, Dr. Jen Superstars. On YouTube, please subscribe to my channel. Click the little bell for updates, guys. I'm Dr. Jen. I'll see you soon.